Fox 40 Capitol reporter Eitan Wallace spoke with one woman who says the program is essential to her daily life and shares how the Newsom administration is responding.
People will die.
That's the warning from Kate Laddish, a Californian who relies on the state's In-Home Supportive Services, or IHSS program for daily care.
I'm the president of the California IHSS Consumer Alliance.
Laddish, who lives with rare genetic conditions and uses an electric wheelchair, says the in-home care services the program provides her and more than 800,000 others across the state are essential for the health, safety, and independence of people she says are some of the most vulnerable in California.
This includes people who can't turn over in bed. Some people need bladder and bowel care. Some people need help with showering, meal prep, help with laundry, help with some light housework, this sort of thing.
But she says those who depend on the program could soon be affected by Governor Gavin Newsom's proposed budget changes to the program. His proposal would shift more than $230 million in IHSS costs from the state to counties, a move advocates fear could result in service reductions if counties cannot cover the difference.
It's what would happen because the counties are broke.
Other proposed cuts would immediately end certain temporary IHSS benefits for recipients who, for whatever reason, may suddenly lose eligibility for Medi-Cal coverage. Newsom's proposal also would tighten financial eligibility requirements for coverage and eliminate the backup provider system that provides a substitute caregiver when a regular provider is unavailable.
This truly is a matter of life and death. People rely on these services. So if I were to lose my Medi-Cal, my way of accessing care, I would die. I have conditions where when I need that medical care, like it has to happen then. I have no other way of paying for it.
This is ridiculous.
GOP Assemblymember Jeff Gonzalez of the Coachella Valley and Imperial County is leading the bipartisan push urging the governor to restore the funding. For Gonzalez, it's personal. His son RJ lives with cerebral palsy and needs in-home care.
IHSS is not a luxury. It's a lifeline. And balancing a budget on the backs of seniors and people with disabilities and veterans is disgraceful.
The California Department of Finance, speaking on behalf of the Newsom administration, said the governor does not wish to make any cuts, but adds President Donald Trump's H.R. 1 law resulted in billions of federal cuts passed on to states, leaving the governor with fewer resources to fund the IHSS program.
People will die. This is the only way the state saves money with these proposals is by people dying. That's just galling.
And important to note, none of this is set in stone just yet. The legislature and the governor still have a few days to negotiate his spending priorities and proposed cuts. The deadline to pass a balanced budget is June 15th. At the state capitol, covering local news that matters, Eitan Wallace, Fox 40 News.